Good evening, Representative Horn, Senator Fanfara, Representative Paleto, and Senator Fazio, and members of the committee. I'm Mark Schaefer, the Vice President of System Innovation and Financing for the Connecticut Hospital Association. Appreciate the opportunity to testify in Senate Bill 1246, an act concerning revenue items to implement the governor's budget. CHA opposes sections 16 to 18, which are the tax and supplemental payment provisions of this bill, which provide following the hospital settlement agreement, they provide for an annual increase in the tax and corresponding increases in supplemental payments beginning July 1, 2026. The proposal is unsound and will cause irreparable harm to hospitals, patients, employers, and the insured, and it does so by adopting the narrow aim of using the hospital tax solely as a means to balance the state budget. What these provisions fail to do is to address the accelerating growth in the Medicaid shortfall, which was a staggering $1.4 billion in FY 2023, and according to the Office of Health Strategy is 79% higher than the national average. It also undermines our shared interest in promoting commercial affordability because the burden of the hospital underpayment must be borne by employers and employees, and it jeopardizes access to care for low-income, uninsured, and underinsured patients. We also have serious concerns that this bill ends the supplemental payment distribution established under the settlement and leaves the state with unchecked authority to modify supplemental payments to individual hospitals, thereby upending 7 years of financial predictability and stability that was enabled by the settlement. Finally, the proposal misses an opportunity to advance the public policy goals that were established in Section 17 of Public Act 23-171 to improve the long-term health and well-being of individuals enrolled in the Medicaid program in their communities. That is the role that the hospital tax should be playing in Connecticut, and it is the role that hospital taxes play in numerous other states across the nation. We have spent a lot of time thinking about another framework for Medicaid and the use of the hospital tax program, and we believe that the hospital tax could be used to substantially mitigate the Medicaid shortfall, to provide for annual increases, and we think that the distribution formula should be established by the legislature. Second, we believe that we need to be focusing on improving the well-being of Medicaid by moving beyond clinical care and engaging the multi-sector health partnerships in our communities that have the ability to drive impact on social, economic, and environmental contributors to poor health. And third and finally, we're proposing a regional financing and accountability framework where hospitals and their multi-sector health partners are held accountable for achieving certain cost and health outcomes, and where the savings are shared back with those communities for reinvestment. That we would welcome the opportunity to engage further on a comprehensive solution for Medicaid redesign and appreciate your considering my comments.
Thank you, sir. Senator Fazio.
So obviously when the hospital tax has been proposed and is proposed currently, it's justified that it's really an arbitrage. We get more federal dollars and those go to the hospitals in exchange for raising the hospital tax. Are you saying that you think under this proposal the hospitals in Connecticut will be paying more in higher taxes than they're going to be getting back in whatever supplemental payments?
It's not so much that hospitals will be paying more than they're getting back. It is the fact that they're not getting any real improvement in the reimbursement that they get for providing care to Medicaid beneficiaries. So they're paying $1 to the state pays the hospitals $2 back. One of those dollars is for clinical care, the other is a return on the tax. They're only left with 50% of what it takes to actually provide the care for Medicaid beneficiaries.
Sorry, so if they're getting $2 back and they're paying $1 more, why would they be upset at that?
Well, let me put it another way. Hospitals pay $1 in taxes. they provide $2 worth of clinical care services to Medicaid. And when the state pays them that $2, one of those dollars is to pay them back for the tax. So they're really only getting 50% cost coverage. The actual number is closer to 58% in the most recent year. But the bottom line is that's not real reimbursement. That is simply doing what you said, Senator Fazio, which is it's taking advantage of the fact that there's federal match available. So currently, we pay taxes of $850 million a year, and about $300 million is used to pay hospitals back, and you draw down $600 million in federal revenue. The state keeps roughly $550 million worth, and that arrangement's continuing, but it's not helping hospitals cover the cost of care. And the further behind we get in that, $1.4 billion, again, we are 79% higher in terms of our Medicaid shortfall than the rest of the nation. That burden is borne by the commercially insured, by employers and employees. That's the only way that hospitals can cover the operating expenses that are not otherwise covered through the reimbursement model.
So your argument is that it's a net tax increase on the hospitals, on the medical system?
Absolutely.
Okay. Thank you, sir.
Yep.